I'm Dr. Christopher Sunday with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. And I'm going to discuss ketamine microdosing and home ketamine therapy as the treatment of depression and anxiety. Now, we know that booster infusions of ketamine help maintain response. So if you have basically received your 6 ketamine infusions for depression and anxiety and have had great result, the question is, how do you maintain that? And we know from a study back in 2009 that basically there is safety and efficacy of repeat dosing IV ketamine for the treatment-resistant depression. And this was by Margie Het-Rott, in which they basically studied the tolerability, safety, and efficacy of repeat dose open-label IV ketamine infusions. They did 6 infusions over 12 days, and basically these were all treatment-resistant depression patients who had basically shown a meaningful antidepressant response to a single dose of ketamine. They found that the Montgomery-Åsberg Depression Rating Score, the MADRS score, which is a measure of depression, after the 6th infusion demonstrated a reduction in 85% of patients, that basically 85% had significant response. And of the patients that they tested, at about 3 weeks post the 6th infusion, 8 of 9 had a relapse on their depression after the 6th infusion, anywhere between 6 and 45 days later. But one patient did remain symptom-free for 3 months. And so, again, this kind of goes to the statement that individuals would need booster infusions every 3 to 5 weeks to maintain antidepressant response unless they're absolutely in remission. And this is, again, a testimony to the fact that depression is a neurodegenerative disorder and that there's going to be constant relapses no matter what the treatments are, and that even ketamine is a treatment, not a cure, but it can basically treat individuals who have suffered tremendously and have had no response to prior therapies or minimal response. So how do we maintain the effect after an initial ketamine series? And we kind of already referred to the fact that you would do multiple infusions, but basically there are other things that you can do to help increase the quality of life, and that would include baseline medication changes for underlying treatment. So, certainly altering the antidepressant therapies and other medications that could have side effects of depression, such as beta blockers. And then there's lifestyle changes, which we cover in another video. And of course, repeat booster infusions, anywhere from every 2 to 4 weeks for some individuals. Just coming in and getting a single infusion certainly helps boost them back into remission or significant improvement so that they have excellent functionality. Now, there are ways to prolong the periods between boosters with home-based ketamine therapy, and that would be intranasal and oral ketamine, which is something that at Nova Health we have significant experience with and have found it to be extremely effective. And so this would be microdosing of these substances. So effectively, we know that only repeated infusions of ketamine prolong the effect. And this is based on basically a meta-analysis and review of articles by Eric McMullen in 2021. They looked at 454 articles and they identified 22 in which they found basically that including pharmacological interventions, psychotherapies, ECT, transcranial magnet stimulation, and IV monotherapy, that really no treatment modality other than repeat dosing IV ketamine was able to significantly prolong the efficacy of IV ketamine in treatment-resistant depression. So we're kind of, again, reiterating what we said earlier, in that boosters are definitely the best way to kind of maintain efficacy in treatment-resistant depression. And also, because you're getting ketamine, frequently, the pro-cognitive effects of repeat ketamine infusions have been demonstrated as well. And in this study here, basically with Zhu in 2018, they studied the neurocognitive effects in 6 ketamine infusions and the association with the antidepressant response in unipolar and bipolar depression. And they noted that there were significant improvements in speed of processing and verbal learning in these individuals, and that basically the speed of processing was improved on a number of different domains. They also noted that ketamine responders had better visual learning at baseline than non-responders. Effectively, their conclusion was that the neurocognitive function did not deteriorate after 6 ketamine infusions, and that's what they predicted. And verbal memory, verbal learning, and speed of processing improved over the infusion periods and was maintained. Further studies of repeated intravenous infusions of ketamine also demonstrated that anxious depression responded better than non-anxious depression. And in this particular study by Liu in 2019, they did repeated infusions of ketamine, 6 of them, over 12 days, and that patients with anxious depression had increases in speed of processing and also in verbal learning and memory. So, what are the routes of delivery that we can give ketamine? The bioavailability of oral ketamine is low when the drug is swallowed. So basically, when you swallow it, you get about 8% absorption with S-ketamine and 24% with racemic ketamine. And it actually increases to 24 to 30% with a lozenge or liquid sublingual formulations. And we usually provide ready-to-dissolve tablets or troches that we tell patients to stick under their tongue for about 10 minutes so that you maximize that absorption. And it's very variable, but some individuals can get quite an effect from that. The bioavailability of intranasal racemic ketamine is nearly complete, with really the loss occurring only if it dribbles down the back of the throat, or basically in other areas of the pharynx. As far as the plasma concentration of IV versus intramuscular or subcutaneous routes, basically IV is more efficient and is double the concentration than when you inject it intramuscularly or subcutaneous. So subcutaneous intramuscular routes are, although very effective, they're not nearly as effective as the intravenous form of ketamine. And so the plasma levels of IM, intramuscular, and subcutaneous ketamine are about half of those as IV ketamine. So that's why intravenous ketamine always works better. It's more predictable. Its bioavailability is so much better. It's 100%. So intranasal ketamine for depression. And when we talk about intranasal ketamine for microdosing and for home use, it's racemic, meaning it's right and left-handed forms of ketamine. And we discussed that in another video. But ketamine, like a lot of substances, has a right-handed and a left-handed mirror image. And there is an FDA-approved version of ketamine. It is called Spravato, and it is S-ketamine. It's the left-handed version. That one was FDA-approved for office use only in treatment-resistant patients who basically fulfill specific requirements, and that treatment is done only in the office, and that is the left-handed S-ketamine. Now, when we give intranasal ketamine for home use, it is right and left-handed form of ketamine, and it's a racemic 50% mixture of both right and left-handed forms. There is evidence, though, that basically the racemic ketamine can work significantly for depression, and we see that also in the clinical setting as well. The home-based ketamine really does maintain efficacy, and for some individuals, it actually improves them significantly as well. So we can look at depression and see it as both an emotional pain, and then of course you have physical pain. And we know that regular physical pain has been treated with ketamine as well. We use IV ketamine for that all the time. And emotional pain is also very painful, but it's just not physical. And we found that relief of physical pain can really diminish mental pain. And we'll look at it in this particular diagram here, in which basically the pathways of pain intersect with emotional pain. And you can see in the lower left side there, which is a little bit off the center of the slide here, that basically using intranasal ketamine effectively goes right up to the brain. It goes right up to the ventromedial prefrontal cortex. And that's basically a critical area of decision making and emotional processing. And this intersects with key areas of the brain that have projections into pain centers. And so you can basically treat physical pain and emotional pain by using intranasal ketamine. Now, racemic intranasal ketamine has been found in one randomized controlled trial to actually improve major depressive disorder. And this was by Lapidus in 2014. And in this particular trial, he effectively randomized 20 subjects and recruited them into 2 test days, 1 week apart, in which they received either ketamine as a nasal spray on one day or saline on another day, and alternated the two. And the primary outcome was a 24-hour decrease in the Montgomery-Åsberg Depression Rating Scale from baseline. And basically, they found a reduction that was greater than 40% in a significant number of the patients. And that this decrease was seen rapidly within 40 minutes even in some 30% of the patients, and that was significant as well. And there was minimal adverse events. And so effectively, they found 44% of patients could be treated for depression from baseline up with just racemic ketamine intranasal spray, and that it was well tolerated with minimal psychomimetic or dissociative effects. Now, there are studies in case reports of using sublingual ketamine for suicidal ideation, and this one here is actually case reports from Lucinda Grand in 2017, in which she documents successful use of sublingual ketamine for rapid release of suicidal ideation. And she also discusses it for chronic pain and depression as well. She has a website where she discusses it in further. Likewise, there is also a study on using low-dose oral ketamine for the treatment of chronic suicidality, an open-label pilot study by Can, and that was in 2021 of February. And in that particular study, they took 32 adults with chronic suicidal thoughts and used subanesthetic doses of oral ketamine over 6 weeks, ranging in doses from 0.5 milligrams per kilogram up to 3 milligrams per kilogram. And then they used medically validated scoring systems to assess everything from their depression, suicidal thoughts, and measures of functioning and well-being. And basically, they found that 69% of patients achieved clinical improvement within the first 6 weeks. And basically, by week 10, 50% still had clinical improvements. And so effectively, 6 weeks of oral ketamine could decrease chronic suicidality and lead to a significant reduction in suicidal ideation based on this study. And then there's also a study that was done on at-home sublingual ketamine with telehealth. And this was for the treatment of severe anxiety and depression. And they used an open-label effectiveness trial in which they used 1,247 completed treatments with sufficient data and found that 62.8% had a 50% or greater improvement in their depression scoring on the PHQ-9, and 62.9% had an improvement in anxiety based on their generalized anxiety scoring, with some 50% or greater improvement. This is just using sublingual ketamine. So effectively, oral ketamine could help significantly with depression and anxiety. And then there's also another study with low-dose oral ketamine for refractory depression, and that also that this treatment was pro-cognitive, using very low doses of sublingual ketamine in refractory unipolar and bipolar depression. This study was by Lara in 2013, in which they basically used a very low dose racemic ketamine, which is R-index ketamine, some 10 milligrams from a solution, and repeatedly administered it every 2 to 3 days or weekly in 26 outpatients with refractory bipolar or unipolar depression. And they found basically that 77% of patients had a sustained effect and improvement of cognition and even sleep. And for some people, there was remission that was remained after they stopped the ketamine treatment. So Nova Health Recovery has been using home-based ketamine and microdosing for maintenance therapy for a long time, and we basically have found it to be highly effective and very safe. It's a great way to maintain efficacy after the ketamine series and to be able to extend out the periods between which patients need booster infusions, and likewise to improve their response to traditional antidepressants. And we monitor for misuse and abuse. Certainly, this is prescriptive, and this is to be used in the home front use only, with the specific use as prescribed, the particular number of sprays or particular number of tablets at a specific time. And of course, no driving for anywhere from 4 to 6 hours after the treatment is given. And we monitor for side effects, and the main side effects would be dizziness and nausea, especially for the low dosing. Generally speaking, for microdosing, you're not supposed to feel anything. There's not supposed to be a trip or any type of visuals or anything of that sort. So the goal is to have the minimal amount of psychomimetic effects when a person does microdosing. And so we kind of titrate to that point so that we maintain neuroplasticity without any of the trippiness. And we monitor functional improvements such as motivation, cognitive function, and mood using medically validated testing and also online testing for cognitive function. And then, as we mentioned, the home-based ketamine therapy can certainly augment your underlying treatments, including psychotherapy, because it can improve your cognitive behavioral therapy and decrease cognitive rigidity. Effectively, ketamine therapy allows you to be a lot more open and able to think outside the box so that you don't have this rigid, fixed thinking that we typically get with depression. And also, as we mentioned, there's a longer response between booster infusions, so people don't need to come in as much for the IV infusions. If you have any further questions or if you have any thoughts, certainly you can reach out to us. If you are looking for further information, we can certainly send it your direction.